What does pain in the perineum mean? So perineum is that space between your external genitals, that's your vagina or penis, and your anus. So when you have pain there, that typically, from my experience, it comes from tightness in that area. That means that it is being used for movement, which that's not what its function is. So when we use something, a different part of our body for movements or for actions that is not their part, it's not because we're randomly just hoping for the best. It's because we're running out of ammunition, so we're holding on to whatever we can to get the job done. So when that becomes your methodology over a course of time, then it's as if you're using something wrong to do a different act. So it speaks up. So tightness or pain, I should say, in the perineum typically means that this individual's muscles on the inside of their body, inside their pelvis, are not behaving correctly. And they're not behaving correctly because they're not able to just do their job. They are picking up what's not happening on the outside of the pelvis. So we're talking about the muscles that are in charge of movement of the pelvis, the structures above, and the lower extremities below. So any malfunction in what's connected to the pelvis is going to lead to pelvic instability and changes in the nature of the muscles inside and the perineum in this case. So from my perspective, the first thing that I see people do is they actually use and clench their perineum when they need to be relaxing. They use it for breathing, they use it to move the pelvis, they use it to stand up, they use it for nothing. It just keeps contracting. So the first step is introducing what's referred to as biological breathing, which is nature's way of trying to relax all of these muscles when done correctly, which from my experience, it's very difficult to do, but definitely not impossible. This is something you have already done as a human baby. You and I and everyone else that you see who's living has done it as babies. And then down the road, when our lifestyle changed, when we started going to school, when we started playing one-sided sports, and when we started having injuries and started doing all these many things that we do, we deviated from that ideal, and that became the source of decline. The fix, therefore, is starting with biological breathing, then it's identifying the patterns of movement that exist that are not correct, and then working on using developmental movements, the same movements you did as babies. That's how you went from helpless infant to running toddlers. Those same things that you did is how you learn to stabilize all different parts of your body. So that's your manual of movement. We're going to use that manual of movement to correct the patterns of movement that exist now. Only this time, you're becoming conscious of what those are because you need to police yourself. I'm sorry you hear this. Your problem is not going to be solved by someone else and to be solved forever unless you get involved. The problem is going to show up in different shapes and forms. It's kind of like, you know, it was nice to have our parents, responsible parents, to take care of us as children, and then we grew up. So there's nothing wrong with it. Those are different phases of life that we have, and that just means that you got to learn what your problem is, learn what right is, what your wrong is, how to stop yourself from doing the wrong things, and knowing what to replace them with. That means you need to invest in learning how to be, and you need to seek help from a provider who's willing to teach you how to be. To teach you as if you're their apprentices, looking at your issue as a project. At least that's what I think. This is what I do with my patients, and I'm proud of it when I see people move on, so they don't have to keep coming back to my office for different problems. If you have not subscribed to the channel, please make sure you do so. I provide a lot of videos on different resources and platforms because I do strongly believe in education about ourselves being the #1 tool in trying to stay healthy and not needing everyone else to solve our problems. Until next time, take care.